from the American Academy of Pediatrics.
Coordinating care between schools and pediatric health providers can present unique challenges.
A new toolkit simplifies the process of school health information sharing.
Families pull back when they feel a loss of control or a loss of trust, or they don't feel part of the conversation. They want their care to be coordinated with them instead of around them.
Plus, we'll look at discrepancies between parent and child reports of social media use among 8 to 12-year-olds.
I think as pediatricians and parents, the more we learn about technology, the better we can help our children use it safely and wisely.
These stories and more on Pediatrics on Call, the podcast on children's health from the AAP. I'm Dr. David Hill.
And I'm Dr. Joanna Parga-Balinki. This podcast is for everyone in the medical community, keeping our children healthy and safe.
It's a show by pediatricians for pediatricians.
But anyone who cares about kids will get a lot out of it as well.
Let's start today's episode with a look at the new toolkit to support school health information sharing. Joanna, now that your kids are back in school, have you been called by the school for any health problems?
Now that I have both kids in the same school, yes. I know I always talk about the peanut allergy that my son has, David, and there have been calls about that. Nothing scary, just clarifying a response to it should we see one.
You know, so much of kids' lives happen while they're at school. You'd think that it would be easy for pediatricians to communicate back and forth with teachers, school nurses, and administrators about their health, but in fact, it can be a huge barrier thanks to laws designed to protect kids' privacy.
There are so many reasons schools need to talk to families about their children's health. Behavioral issues like ADHD, learning disabilities that need special support, or medical issues like the food allergies I deal with, or asthma, diabetes. So the forms we pass back and forth can be pretty complicated.
They can be, which is why the AAP has released a new toolkit to simplify the process, tools to support school health information sharing. Today, we'll learn more about this kit from one of the contributors, Dr. Heidi Schumacher.
Dr. Schumacher is a general pediatrician and associate professor of pediatrics at the University of Vermont Larner College of Medicine, where she serves as faculty for the Vermont Child Health Improvement Program. She has held leadership roles in the public education system, and she's a member of the AAP Council on School Health. Heidi, welcome to the show.
Thank you so much for having me.
So to start, can you help us understand the legal landscape that this toolkit is spanning? Let's start with our old friend HIPAA.
Sure. So HIPAA, which I think our audience is very familiar with, the Health Insurance Portability and Accountability Act, is a federal law that protects the privacy of health information. I think that's one that we feel pretty comfortable with in our everyday practice.
And then what about FERPA? I take it it's not Harry.
So FERPA is the Family Educational Rights and Privacy Act, which is essentially the education equivalent of HIPAA. So it protects the privacy of educational records and other things held by the school.
So when you were making this toolkit, what sorts of information did your team envision schools and medical homes would be sharing?
So I think as context, we know, and Dr. Hill, as you teed up, schools and healthcare are often supporting the same kids and families, often on the same types of issues and opportunities, including related to health, growth, development, social factors. And we also know that health challenges are some of the leading reasons that kids miss school or have obstacles to success in school. And yet, of course, we know across these examples and many others, too often these sectors are supporting families in silos. And our project is really envisioning a world in which schools and healthcare can partner to closely wrap around young people and their families and share relevant information. So plans of care, academic information, relevant information about health conditions or medications, et cetera, but really always with families at the center. So aware of and engaged with these professionals in that information sharing.
The toolkit includes a template consent form for sharing information between the school and the medical home. How did you go about developing this form, and who all did you need at the table?
So the template and toolkit both were really great, fun, collaborative efforts, I will say. I came to this being interested in this work because I'd been doing general pediatrics and school health in a few jurisdictions. And I found that in all the settings where I had practiced and worked, the same types of challenges were coming up. That sectors wanted to partner. We thought families wanted us to partner. We believed we should be partnering, but lack of consent kept coming up, resulting in gaps in care and real missed opportunities. And in many cases, I was experiencing that folks were asking for consent really only when something had gone wrong. So there was an issue that had come up. We asked families for consent, and then perhaps they have concerns, or we only have one side of the consent, but not both. So I wondered, surely someone out there has a consent form perhaps that I could build from, use. So I reached out to the AAP Council on School Health listserv, which is the best listserv, very active. And I asked, does anybody have a consent form that they could share that goes both directions? And within 3 hours, my inbox was full of folks who all said, no, we don't have one, but we want to be part of a solution to make one. We should work on it together. And then from there, we looped in Council on School Health staff. We brought in the National Association of School Nurses. And from there, we really used existing templates, unidirectional templates from across the country, pulled elements that we thought were really high quality, and then we leveraged staff and physicians from the AAP, from NASN, and many other partner organizations, both in the development phase and the peer review.
And how did you get families involved in this process? And did you find that families had concerns about what information might be shared?
So overall, I found throughout my career, and I think we found in this process, families really do want their care to be coordinated across sectors. What I found is that families pull back when they feel a loss of control or a loss of trust, or they don't feel part of the conversation. They want their care to be coordinated with them instead of around them. And so we did leverage family voice. We had family reviewers at multiple phases of this process. And we were really intentional in both the template and the toolkit to aim to get to a tool that not only checked a legal box, which is what I think many of our consent forms currently do, but really was a tool for informed engagement with the families that described the what and the why and the how for how this would all work in a way that really engages families from the beginning.
And you encourage users to personalize these forms for their own needs. What sort of tweaks did you have in mind when you thought of that?
We do. So first of all, we built these tools to be compliant with federal law. So HIPAA and FERPA are both federal privacy laws, but many states have additional layers of privacy protections in state law. So certainly we describe all over this that folks who are using these tools should engage with state or local legal supports to inform any additional adjustments to cover state law. But we also sort of more programmatically included sections throughout for families to specify things like, are there specific people you're giving consent to share information or receive it? Are there specific types of information you want to have shared or don't want to have shared? So we really give space and guidance throughout, including through footnotes of places where schools, healthcare, or families could customize to give more control over what's shared.
And before people implement this form, you recommend them performing a bidirectional communication environmental scan. I take it that does not involve an ultrasound?
So the toolkit overall includes a lot of resources. Again, we wanted this to be not just a template to check a box, but really a whole set of resources that jurisdictions, practices, schools could use to build this in a way that felt intentional and genuine. So within the toolkit, we have commonly asked questions, we have a planning and implementation checklist, the environmental scan, as you mentioned, Dr. Hill, a 5 things checklist, and even a script to explain to families what this is all about and why. The planning and implementation checklist is really meant to be a set of steps for folks to move through this process. So beginning with things like assemble your team, conduct the environmental scan, define what you're solving for, et cetera. And in that environmental scan list, we really ask folks to essentially reflect on who and what they have at the table. So who's on their team in the school? Is it a diverse representation of voices who matter in this work? Does it include youth and families? Does it include staff, policymakers, maybe the school board, healthcare clinicians as appropriate? Do they have the right legal and administrative voices who've been pulled in? And importantly, are there existing consent forms or workflows that you could work from? There's no reason to start from scratch. This template is one template that you could use, but you could use these procedures even with your existing consent forms and make something great from that. So overall, we really are trying to encourage folks to capture what works within these current processes, tools, where are there gaps or specific needs, and then how can that inform a targeted approach that has a clear definition of success.
As a part of these materials, you also provide a script to help school staff and the medical home explain more to parents. Why do you think that this scripting might be helpful?
I think generally I'm guessing many listeners have found when we ask for consent from families, again, it's often sort of a box check, like sign this form. It's maybe in a stack of forms. I don't find that people often spend time really walking through the what, the why, the how. Consent or information sharing really benefits that child, family, community. And in this case, I think we've found, indeed, many people may have concerns about consent because they don't understand the benefit to their child. And so the script is really meant to walk folks through what language can you offer to families to help them understand why we're asking consent, how their child or family may benefit from it, and the control that they will continue to have over what information is shared and how throughout the process. So it's really meant to ensure that families feel informed and aware of what this is all about before we're asking for their consent.
And we've not nearly covered everything in this toolkit, but do you have one takeaway you want to be sure people know about this process?
I think the biggest takeaway is that our patients really do want us to coordinate their care. They want us to partner with other professionals who serve their family, but they want to be informed and aware and at the center of that information sharing. And so we feel like this toolkit and the template is essentially a family engagement tool to help folks be part of an integrated solution that brings sectors together in service of that child and family's needs and in a way that really centers the family. And I just feel really lucky to have been part of the group that put this all together. And we remain a resource for folks. If you're piloting it, if you're testing it out, if something works or doesn't work, or you have questions, please reach out to us because we'd love to be a resource. And that helps us refine the tool for the future.
Dr. Heidi Schumacher, thank you so much for joining us today.
Thank you so much for having me.
To access the implementation toolkit to support school health information sharing, visit our website at aap.org/podcast.
Coming up, we'll discuss discrepancies between parent and child reports of social media use among 8 to 12-year-olds. I'm curious, Joanna, do you feel like you have a pretty good handle on how Simon and Mira are using the internet? Can you say what platforms they watch and what they do there?
Because they are so young, yes, they have iPads that they can only use on the weekend, and I control the downloads and also the time spent on them. I'm really nervous as they get older, I'm not going to have as much of a handle on things.
Well, I can tell you we tried really hard to monitor our kids' media use when they were younger, but even then we ran into some surprises. But now, a study in Pediatrics Open Science, discrepancies between parent and child reports of social media use among 8 to 12-year-olds in a primary care setting suggests that what parents think they know and what their kids are actually doing may be pretty far off.
This does not surprise me. How did they do the study? What does it show?
Well, maybe the best person to ask is one of the authors, Dr. Xuan Chen. Dr. Chen is a general pediatrician practicing at Piedmont Pediatrics in Columbus, Georgia, who has a special interest in social media in children. Dr. Chen, welcome.
Thanks for having me. It's a pleasure to be here.
So this is a really intriguing topic. Many of the studies I've seen looking at media use are for young children or teens. Why did you think this age group of 8 to 12 was important?
So we started this survey when we first noticed in the clinic that an increasing number of kids are bringing their digital devices, as you said. Sometimes it's an iPad, sometimes it's their parents' phone, and you just wonder what they're doing on there. And then, as you said, most of the research right now is focusing on kids more than 12 years old. And you would think that's the age that they started to explore those social media platforms. However, those medias are really open to anyone to download. So little are known about what's the impact on younger kids and if their parents really know about what they're doing online. So that's mainly the reason we're doing it.
And you surveyed both parents and children for this study. Can you tell us a little about this survey and how you administered it?
So our team, led by Dr. Anand at Kings County Hospital in Brooklyn, New York, conducted this single-center cross-sectional survey in a large urban pediatric clinic. So we were able to recruit 221 parent-child diet with the kid aged 8 to 12 years old. They were each asked to fill out a survey by themselves with different questions on the patient's social media use. For example, we asked them if they have a device of their own, how much are their screen time, what's their nighttime use conditions, and what platforms do they choose, and what's their social media behaviors. And we also collected their demographic data.
And when you started analyzing the data, what stood out to you? Were there some areas where parents and kids reported similar use?
Well, before I start to tell you guys about the result, I wanted to ask you a question. When we're talking about social media platforms, what comes to your mind?
Oh, gosh. Well, I'm old enough that I still think about Facebook, but we think about Instagram. I think more refreshing, there are a lot of games that function as social media as well. There's Twitch, there's
Pokemon Go, of which I'm an avid player. I also think about Instagram too, David.
Well, exactly. That's what I thought when we started to do the 20 patients pilot study. But the kids are surprisingly telling us something different. They're telling us YouTube and Fortnite and Roblox and Minecraft as their social media, because apparently those online video games, well, if they're foreign terms to you, they're all online video games. They allow them to interact with chats, voices, videos, and sharing contents, and those are considered social media nowadays to kids. So a good thing we found out was that most parents know about their kids are owning devices. And the younger the child, the more awareness parents have about their device ownership. And that's at least a good start. But unfortunately, we're finding a lot of discrepancies between the reported use of social media between parents and kids.
And where were the most alarming discrepancies between what parents thought they knew and what kids said they were actually doing?
So in our survey, children are reporting longer screen time, both on weekdays and on weekends, and even after bedtime than what their parents are aware of. I'll give you an example. The mean weekday screen time reported by children was 3.5 hours, while their parents are reporting only 2.9 hours. And about 70% of the children reported having at least one social media account, but only 44% of parents are aware of it. And 62% of children reported device use after bedtime, but only 32% of parents were aware of it. And children also seem to be playing online video games without their parents knowing, where they really function as social media.
And Dr. Chen, were there any findings that you found particularly surprising or alarming?
Yes. So there is a particular age that is associated with the largest discrepancies between the parent and children's report. Do you guys want to take a guess at what age is that?
12?
Ooh, I'd probably go 12.
I think that's a very reasonable guess. But actually, it is 11 years old. And when I think back, it kind of makes sense to me because this is the age that it started to grow self-centeredness and the need to separate from their parents and to compare with their peers. So this seems to be a transitional period that the parents are not catching up with their early adolescence in our study.
So just how concerning do you think these findings are?
Well, I am certainly very concerned about the discrepancies, both as a pediatrician and as a parent-to-be. Our data suggests that parents may underestimate both the frequency and the nature of their children's online engagement. And we know that social media use has been associated with lower physical activity and more internalizing symptoms. And this lack of awareness really precludes a lot of relevant preparation and timely intervention, or sometimes necessary rescue in certain scenarios.
So for the children who had high media usage, were there demographics associated with that group that stood out to your team?
We did collected parent demographic data, and we have some interesting findings. Most of the parents, no matter what their socioeconomic status are, express the concerns of their children's social media use. However, the higher education level and income status are showing more awareness of their children's media use habits. And on top of that, their kids are also less likely to report having a social media account or playing online video games.
And do you have any thoughts about how these results might change how we as pediatricians counsel parents or the sorts of policies that we advocate for?
That's a great question, and I think that's all this research is about. As primary care pediatricians, we emphasize on anticipatory and preventative guidance about diet, sleep, safety, etc. in our well-child visits. And I think this is also a great chance to incorporate the digital behavior assessment as one of the routine care. This may include a brief screening question about how their kids are using devices and parental knowledge of social media accounts. And then from there, you can kind of uncover if there's any discrepancies and raise their awareness. And then you can go ahead to guide the parents through how to better supervise their kids' device use. And here, I really want to give a big shout out to AAP, who has been offering so many good resources for pediatricians and parents. One of my favorites is the Family Media Plan, which is available on healthychildren.org. This allows the families to establish a healthy media use habits together. And the other great advice is to have parents learn about and even participate in the technologies that their youngsters are using, and ask routinely their kids about what are you doing online and how do you feel about it. And some apps do allow you to set a parental lock to protect and restrict the contents they're seeing and the friends they're adding. And that's pretty much it. I'm very glad to see that some software companies are starting to take actions to assist parental control on social media and general device use. But certainly, there's a lot more we need to learn about the healthy use of social media for children in this day and age.
Okay, this makes me feel even more committed to watching my kids' electronic habits. Do you have any last takeaways for us before our listeners read the study for themselves?
Absolutely. So I think technology is coming and is changing every single day. We cannot just simply avoid using it because we're scared of its downsides. I think as pediatricians and parents, the more we learn about technology, the better we can help our children use this safely and wisely.
Well, I feel better speaking to you today, Dr. Xuan Chen. Thank you for talking with us.
Thank you so much for having me.
To read the study, Discrepancies Between Parent and Child Reports of Social Media Use Among 8 to 12-Year-Olds in a Primary Care Setting, go to our website at aap.org/podcast.
At the end of every episode, we like to leave you with something positive or enlightening. We call this segment Say Ah. David, what's your Say Ah this week?
That's an easy one, Joanna. I just came back from visiting our youngest, Julian, away at school. He introduced us to all of his closest friends, and I just take a lot of pride that he doesn't want to hide us, right? He wants to introduce us, and that was such an honor. I even met his academic advisor and had coffee with him, and it was just great. So Christy and I loved that trip.
Since your say was about being proud of your kid and where they are, mine's going to be about the fact that we started piano lessons with my 7-year-old.
Ooh.
And it is so fun. She is learning a new instrument, and I played piano when I was around her age and started it. So it's just really fun to watch her explore music.
I'm jealous because I started piano when I was about 13, and it's a little late, honestly. I'm still not at all good. So go Mira.
Yeah, I think 7's a great age.
Well, that's it for today's episode. If you like Pediatrics on Call, please subscribe on your favorite podcast app and help us spread the word. Follow us on YouTube, Facebook, and Instagram at Pediatrics on Call.
Pediatrics on Call is a production of the American Academy of Pediatrics. Our producers and editors are Ann Johnsos and Claire Keating. Our audio engineer is Doug Nagel. Joe Puskars is our associate producer, and Susan Martin is our executive producer. Our theme music was composed by Matthew Simonson. Join us next week when we'll look at new interim guidance on the use of leucovorin.
We'll talk to one of the authors, Dr. Alice Kuo. I'm Dr. David Hill.
And I'm Dr. Joanna Parga-Balinki. Thanks for listening.